Assalamu alaikum everyone. So we are talking about basics of ethics. So principlism is one of the theory that is very important in ethics, in bioethics, for researchers, for doctors and for nurses and for medical health providers. So first we will talk about principlism. Principlism actually included four universal and basic principles. The four principles are autonomy, beneficence, non-maleficence, and justice. So principlism was started in 1980 by American writers in the form of a book entitled as Principles of Biomedical Ethics. So this book was written in 1980. Its first edition was written actually in 1980 by American writer, and now in 2021 its sixth edition is published. So actually principlism was understood in 1980. It's a previous term, it's not a new term. So again, there are four pillars or four concepts that are included in the principlism, that are autonomy, beneficence, non-maleficence, and justice. So let us talk about each pillar one by one. So first of all, I will talk about autonomy. So autonomy is related to patient. So it is related to patients and healthcare advisors or doctors or nurses. So autonomy is a right of patient, is complete right of patient about any medical treatment, whether he wants to take treatment or not, what type of treatment he want to take, and like any other decision he want to take about his medical treatment. So his decision should actually be independent. So his decision or decision of the patient should be without any external pressure, without any pressure of doctor, without any pressure of family, or without any pressure of any other social pressure. And the third point is autonomy is a basic right of patient, but it can be denied in some cases. For example, autonomy of patient can be denied if his decision is not parallel with the betterment of society. Now I am giving you an example of a patient. So it is also an example and question. You have to answer this. A patient has active tuberculosis. You know, tuberculosis can be spreaded by the aerosol particles that are carried from his cough, that come out of his mouth through cough. So he is denying to take medicine or following any medical treatment or any medical precaution. So either his autonomy about this decision should be maintained or denied. So everyone should explain it. I am telling you that this decision that he will not take any medicine can be harmful for the society because he can spread TB to others. Now again, patient autonomy. So it is treating a patient according to patient desires. Then a patient decision should be considering patient need and abilities. So again, protection of the patient privacy. Again, so as a summary, patient autonomy is defined as it is the right of patients to make their decisions about medical treatment, and their decisions about medical treatment should be without any influence of health provider, doctor, or family, or without any social pressure. Next pillar of principlism is non-maleficence. Non-maleficence is related to doctors. Doctors, physicians, health providers, nurses, scientists, or researchers. The sign of non-maleficence is do not harm. It's mean that any action of medical health providers will not harm the patients in any way. So they will do good, and they will not allow any harm to reach the patients or reach the society. So the third point is the researchers, doctors and nurses should keep in mind that the ratio of benefits or the quantity of benefits for the patient under their treatment must be greater than the quantity of risks or dangers or negative aspects. So what is included in non-maleficence? Let's explore one by one. So they say do not kill. Second is do not cause pain or suffering to others. So do not cause offense to others. So do not deprive others for the good of life of others. So again, let's go to the detail of non-maleficence. That is the second rule of principlism. Principlism का second rule क्या है? Non-maleficence. इसकी डिटेल में हम जाते हैं. So we have to protect the patient rights. हमें patient के rights की हिफाजत करनी है, and keep him away from any harm. उसे किसी भी नुकसान से बचाना है. और किसी भी डॉक्टर या स्पेशलिस्ट को पता होना चाहिए कि उसकी क्या लिमिट्स है, कौन कौन से इंस्ट्रूमेंट्स और कौन कौन से ट्रीटमेंट्स वो प्रोवाइड नहीं कर सकता. इस केस में वो उसको बताए, उसको इन्फॉर्म करे, उसको नॉलेज दे कि वो किसी और जैसे रेफ़र कर देते हैं किसी और बड़े मेडिकल स्पेशलिस्ट के पास या किसी और बड़े हॉस्पिटल्स में, अपनी लिमिटेड स्किल्स की वजह से या अपने लिमिटेड नॉलेज की वजह से सिर्फ उसका इलाज ना करता रहे कि उसको नुकसान पहुँचे. So next is let's go to the third point, that is beneficence. So beneficence, the word beneficence, ben is taken, its mean good, benefit, and FIC face, its mean action or doing. So its mean action done for the good of others. Beneficence means ऐसा काम जो किसी की भलाई के लिए किया जाए, किसी के अच्छे के लिए किया जाए. So it's very easy. Let's take an example. A traveler was beaten by a robber, and he was left in the passage to die. He was badly injured. Then some traveler passed by injured and without giving any help. I mean, traveler passed around the injured man and they did not offer any help. In the second case, someone has passed through the injured man, bound up his wounds, take care to the doctor or hospital, and cared for the injured man. So what is beneficence? What is good? What is good action? It is we can naturally decide that second action is included in the beneficence because it is done for the good or betterment for the person. So we can easily understand what is the meaning of beneficence. It includes any good action, admirable action that is not falling in our duties. I mean कोई इतना अच्छा काम है जो कि आप अपनी ड्यूटी से हट के भी कर सकते हैं. Admirable action that is exceeding our duty or our obligation. So let us discuss the examples of maleficence. For example, donating kidney to a stranger. इससे आपको कोई फ़ायदा नहीं पहुंचने वाला. या like you are giving your kidney to a stranger, like it's virtue, ये नेकी भी है और फिजिकली आपको कोई फ़ायदा इसमें नज़र नहीं आ रहा. So there is a question for you to judge whether you are knowing beneficence or not. So question is, you are riding a bus. Suddenly one of passenger fainted because of any disease, for example hypoglycemia and fatigue. So what is your action in the light of beneficence? एक पैसेंजर है जो कि बस में राइड कर रहा था बट बेहोश हो गया किसी वजह से, किसी बीमारी की वजह से. आपका एक्शन क्या होगा बेनिफिसेंस की रोशनी में? So you have to write in the comments. So other examples include to offer water to thirsty, to give shelter who are homeless, to feed the hungry, to give love and care to orphans. Let's move to the fourth pillar and the last pillar of principlism, that is justice or fairness. So generally bioethics, in bioethics we are dealing with healthcare providers, nurses, doctors, scientists and researchers who and their action are related to patients. So I will talk about patients. So justice means to be fair in their work, in their dealings, in their actions with patients, colleagues and society. So it's necessary to do your duties, to do your healthcare duties or any other duty without any prejudice. So should not deny your service to patients. For example, you should not deny your service to patients. You are a doctor and you should not deny your service to patients because of their complexion, because of patient race, because of color, nationality or either sex. Your duty or your service should be equal to all of the humans. So there should be fairness in decision, equal distribution of medical resources and medical treatments. So I have explained there in summary these are the pillars of principlism in medical ethics. So I have given the detail of four pillars. So you should write about one by one about one topic one by one. I have mentioned the roll number in comments. So let's talk about bioethical decision. Bioethical decision making is actually, it is a process by which a diagnosis or treatment is decided or planned. कोई भी ट्रीटमेंट, कोई सर्जरी, कोई डिसीजन प्लान किया जाता है, बनाया जाता है. हाउ? फ्रॉम द डाटा दैट इज ऑलरेडी अवेलेबल and the condition of patient, for example, their immunity and any other data, their disease condition. So in simple words, कोई भी medical decision आपने लेना है by collecting all data and patient preferences also. So what are the points that should be considered by taking medical decision? Number 1. So जो इंडिविजुअल के फ़ायदे हैं वो कम्युनिटी के फ़ायदे पे आपने उसको प्रायोरिटी देनी है. इंडिविजुअल के फ़ायदे को आपने मद्देनज़र रखना है. पहला ये है. सो आई विल से इंडिविजुअल इंटरेस्ट और नीड्स should be prioritized as compared to community. First point is individual betterment, individual needs, individual health should be prioritized as compared to the community. Next is short term should be weighted as compared to long term. So third one is you have to provide justice as compared to mercy. So it should be end-based decision included on the principle the greatest good for the greatest number. End-based mean कि सबका भला हो रहा है. इसको हम इस चीज़ को भी माइंड में रख सकते हैं. सेकंड इज़ रूल बेस्ड एंड थर्ड वन इज़ केयर बेस्ड.